It's a absolute pleasure and a joy to have you. It's my privilege to have you on this show, Doc. I know that you're a very busy man, especially and at a time like this. Thank you very much for taking your valuable time off and being a part of the show. Very welcome to you. And how are you doing, Doc? I hope everything's all right. How are things in Kandy?
Yeah, good evening, Charith, and I'm really happy and to join your show. And first and foremost, I think I must extend my thanks to Yasiru Bandara, who is the person who actually connect with you and did all the groundwork to make this show a reality. And I'm really thankful, and I think within a very short notice, I think we had a very good conversation and also the preparation for this discussion, and giving some insight to you about Kandy. As the central province, the situation, like weather, like today is the pretty gloomy day, and we had a couple of showers, and it's quite cold now, but relatively. And coming to COVID, absolutely, we are also not as bad as some of the parts of the country like Colombo and especially Kalutara, Gampaha, but we are maybe in the third, fourth, or fifth phases. But unfortunately, there are some pockets identified with high number of cases, and also basically we had quite, I would say, there are number of actually COVID care centers, more than 10 around the city, especially the Kandy region. Of course, the central province also covered, and there are, almost all the centers are now flooding up with patients. And also from the hospital side, I think many high dependency beds capacities are being filled with patients. So my message is to you have to take all the precautions, not to take treatment but to prevent it. So this is the basic situation. And at the moment, I think compared to Colombo, I would say the movement of the people are very less in Kandy. So It's not very congested, or I think fairly it's a very good sign. But people at home.
Good news, Doc. It's in Colombo. That's like, okay, as you rightly said, the travel restrictions are on. So we get mixed messages. We don't know what's happening at ground level. Doc, any particular reason why the numbers keep going up, though we are in a lockdown scenario, but it's not showing, that the numbers are coming down. It keeps going up on a daily basis. Is there any particular reason why that's happening, Doc?
So it's like that because now when we think about these new variants of COVID virus, because its behavior is somewhat different, like what we have experienced in the first wave. So therefore, because even the disease pattern also a bit changed. So I'm actually going to talk about a few words about this new variant, how it behave, and also why these the phases are being little dragging, like rather than we feel like that it's maybe within 14 days time everything is being settled, or maybe settled into a certain extent, but things are, the actual picture is not the same. So therefore I think I'm actually trying to elaborate, because it's timely needed requirement by the people that as you know that there are a lot of myths and also the false informations are circulating within the social medias and many other sources without knowing the scientific fact. In fact, the basic problem is actually now even the scientists, the leading countries also find some difficulties to analyze and also to find some of the realistic or research-based information about the COVID infection, because it's so rapid. And also within a shorter period, sometimes you are not, the time factor is not enough for us to go for certain evidence-based, the scientific base, the information to be find it out. But there are massive number of research happening all over the world, including Sri Lanka. And I think at the moment we are getting fairly good information, especially the scientific base. So I'm very happy actually to share some of these facts, the scientific facts. I mean, this is very important for the society, and also if you know the real facts about this disease, I think people can really react on how they behave, how to prevent, even if you get infected, what to do, and rather than getting into the bad phases and ultimately go for very sad situations. So
Right.
that's the story. And just to answer your question, why these numbers are not reducing, in the sense, actually that is also the one factor that we have to really think about. Why this because if you see this, most of the people now, they are not coming out with their problems report to the hospital. Sometimes they remain in the society, or they remain in their houses. In case what happen, if you are in your house with infected mild symptoms, because they don't take sometimes the precautions, and that could be a reason, actually. Then you will have some other problems, actually getting these infected cases, because the whole families get infected. So anyway, that's a clusters building up. So I think with the time, maybe, I don't know, because that is, again, we have to analyze and see whether are we going to really extend this the period of lockdown further, and to take the precautions until we get a proper control.
Right, Doc. Yeah. So, and you were also a little concerned about the death rate. That you felt that it's a little alarming, and it's a little too high, for your liking. Is that right?
Yeah. So actually, Charith, like now we see the death rate is, if you see the past couple of days, I mean, almost all the death rate gone beyond 40 numbers, maybe 45, 46, 48, like high numbers. But even though, I mean, they sometimes this death rate actually coming, sometimes the accumulation number of maybe last couple of months, 2-3 weeks time. But at the end of the day, it is the number. So you just get it this accumulation per day. So if you I mean, that's a very alarming sign. That's actually the red flag sign. I'm telling, if you get 48 cases per day, if it is divided by 24, that's mean every half an hour there's a death due to COVID. So
Yep.
that's we have to really think, and that's a message that the people should understand very, very clearly, and we have to take every possible measures not to get the disease, or prevention of infection. And it's easy, actually, if you really do adhere to the all the regulations given by the government and the health sector, and also the worldwide regulation is there, the local regulations is there, and it's just follow this for a small period. And you have seen that most of some of the countries, leading countries who are really hit with this virus now, they are recovering from this the problem, and gradually. But I know there are some in and out, there are some outbreaks, but anyway, basically we can see like fairly good control. I think we have to actually come into that phase without any delay, and with all these measures. That's actually, this responsibility is on our shoulders. Each and every individual should take this responsibility on their shoulders, and show that we have to recover.
Well said, Doc. So it's a good and a big hi to everyone who has joined us already. So many people. Yasid De Silva, very good evening to you. As Mervin says, that probably the flood situation in the country is also not helping the cause too much. Yep, you're probably right. Probably it aggravates things, and it's not making things easier for the field officers who are up front, the medical staff fighting the pandemic up front. So we wish them nothing but the very best. Hopefully that the things will come under control. Doc, do you personally recommend this extended lockdown? Perhaps that it was extended by another week. So you reckon that's the way forward?
So actually everything depends on the data that we are receiving. Actually, sometimes we may have to go on scientific data as well as the other factors around this particular whole concept. So I think with all these measures, I think there may be some kind of a extension would be recommended, but we'll see with the rest of the days, because now at the moment our lockdown period is extended to 14th of this month. But I think if we take the correct measures and with the commitment by the people and also the other parties, of course, I know that the health sector and even the other supportive the groups of the society, and they are giving their best at the moment. And I'm very happy to say, now because of the vaccination given to the health sector at the initial stage, now they are pretty confident, and also they are to offer their service to even in these rising cases, because unlike in other countries, I think we haven't seen any of our health professionals are cursing and asking for these things, their demands or whatever the things. But I'm very proud to say, from the consultant to the the very junior level people, even from the Triforces and all these support police, and also the other health professionals, especially the administrators doing their best.
Obviously, Doc, there's no question about it. As I said before, respect and deepest respect. All those people are fighting up front. If not for them, we would have been in the situation would have been even in a worse kind of scenario. It's a very interesting question raised by Aruna Samarajiva, who's been a big supporter of the program all along. Watching over 13 months, living with face mask, how would it affect supply of oxygen to the brain? Are there any long-term effect wearing the mask, Doc? It's a good question.
Yeah, it's a very good question. Actually, at the moment, because we haven't come across any studies done, evidence-based studies. So everything, what we are going to talk about, many things today is actually based on evidence-based, because you can't. Human body is a remarkable structure, I would say. The adaptation, which is happening when you are changing your behaviors and your patterns, or maybe your day-to-day life, and the human body is very reactive to and change, and it's coming to the new set of physiological change, and it has its own effect. But in fact, this mask effect, for an example, right, it's also again depend on what kind of mask that you are using. We have very recent research done in 2020 and published. It is coming from actually Hong Kong. They have find out that this mask, that is, they are calling it the mask exercise. So they have actually found out there is some kind of a reduction of saturation, especially when you are using the cloth mask, but not with the other mask. But as you said, but there is a extra effort that the people has to put on this particular when you are wearing a mask. But more than that, actually what they have observed is actually it is the difficulty in breathing, and also the skin irritation, and also there's a moisture around the mouth when you are wearing a mask for a longer period. But the body, the other parts actually are affected. But these this oxygen supply to the brain, at the moment there is no strong evidence that, because I think it will take another couple of months to there are some research going on, so to find it out, the actual factors or what is happening. But of course, if somebody is having some respiratory problem and other issues where their natural saturation is going down, and their strong advice is to you have to control the wearing time of the mask, because if you find difficulties, So always advise to remove the mask, but in a safe manner, and also to get the your normal breathing. But you can't do it in crowded places, but you have to go to your own room or a open environment, and you can do. But it is always actually at the moment in the form of studying these effects. But as I mentioned earlier, but up to now we don't have a very scientific evidence to tell you about the long-term effect of wearing mask.
Wow,
The other
it's
thing,
interesting.
wearing masks, actually I know, because we have the first-hand information from the respiratory units all around the country and the College of Pulmonologists, and they said the worsening of the other respiratory conditions and also the infections, the respiratory infection has dramatically gone down. And if you take the people who has having asthma, because of this mask effect, the worsening of the asthma cases due to dust and other problems is been really going down. And because of this lockdown situation, and also with the other restriction of the movement and the vehicle, there is a relative clearance of the environmental air. So that also, these petrol fumes and all these the carbon monoxide which is coming from factories and all these city pollutions and the air pollutions rate also going down. So relative reduction of the worsening of the condition and also the new cases also we are observing right throughout the country. That's a good sign. Always there is a good as bad as well.
Absolutely, I was going to say that there is a downside and like a positive side as well. There can be there can be instances wearing a mask, and especially if you got respiratory issues, so on and so forth, it can complicate. But on the other hand, it probably will benefit also. So there's always a balance in I guess in life. There are so many questions coming in, Doc. Before you move on to your main segment, and it's another interesting question. Big hi to Sumali all the way from Kenya, and Auntie Sheila all the way from Canada. You have a worldwide audience, Doc, which you really
exactly.
wanted to speak to all these people. They are joining from all over the world. Big hi and welcome to the show. And it's another guy, Asanda from he's from Qatar. He's based in Doha. He's asking about the PCRs, how reliable they are, and what's your opinion about the PCR tests. I have a question for you, Doc. See, I got my vaccination about a few days back, and I'm just want to know if I go for a PCR test now after the vaccination, can the PCR tests become positive after a vaccination?
It's like that, yeah. Of course, because that's the reaction that you're getting your body. Sometimes you might get, but you should know the one really fact. But it's like that. Let's say the PCR is a very sensitive test for even a small amount of whether the infection is there in your body, because it really the test sensitivity is sometimes more than 80%, 90%. So I at the moment actually there are some the problem is whether you become false positive or false negative. So that is where the contradictory, maybe these controversial issues are coming on. But at the moment, because you have to realize the fact, because so for an example, for you to test your knowledge, so you have to sit for the exams, right? So I mean, we don't have any other option to test your knowledge. If you have any other options, yes, it's okay for you to get the information. So it's the PCR, right? For you to get the confirmation. So that's the best test at the moment, because we haven't not yet developed actually
Any other
test. So therefore actually sometimes there may be it's always like that, all these tests, if you take any other the blood test or maybe other testing, they are not 100% accurate. Sometimes you might get some false negatives, false positive. So that's the basic of this. But at the moment we have to rely on this particular the test. And also the other issue is actually sometimes you might see, so, and it is the viral load again that inside your body. And also these are all tests that you take a swab, some sample from your, especially the nasal or in the deep throat. So sometimes, if you are not taking the sample properly, if you take a wrong sample, or if it is not touched the real area, sometimes you might not get the test positive. So there are some practical issues as well, but usually so we have to rely at the moment this PCR, and we have to continue.
Wow. So what you're saying is there's no other tool available at the moment to test. You have to have a PCR, and it has to be done properly. And what you're saying is, after a vaccination, if you take a PCR, that can be that the PCR can come positive.
Yeah. For example, actually, so PCR is actually, that is then you can check for your antigen test. Okay. So that is antigen test only give you some recent infection. So that's the other part. And there are some antibodies also can be checked, that is from the blood test, but that will give you an idea of the past infection, not a very recent infection. So the thing is actually this, even sometimes the virals, the induced antibodies maybe remain for a longer period in your body. So they are therefore sometimes you might get this positive test. So therefore you don't need to actually worry about these things. But only thing is, again, we have to take all the precautions, then and there. So it is obvious. Now we know that even if you are taking your vaccination, and you might get infected, but you can be a carrier of the infection. But thing is that you are not, because your body is getting immune to fight against, but still you can be a carrier. That's what we are telling, that's a problem again now. That means that if you are taking your vaccines, but still you have to take all the precautions. If you are going home, if the people at the home is not vaccinated, so if you are a health worker, or if you happen to go to outside and associate, even if you are vaccinated, you have to take all the precautions, because you can be a carrier and you can bring the vaccine to your house, and the household, the people can be infected. So that's the message here.
All right. What you're saying is, Doc, even after the vaccination, you can be asymptomatic, so you can carry the virus, and you can infect the people around you. So it's better to take all precautions. Big hi to Boatu all the way. He says 2 a.m. in the morning. In New Zealand, he's watching it all the way, and he's still watching. Big hi to him, Carol. Good to have you on the show. There are so many questions. Perhaps, Doc, we might not be able to answer all the questions that people are bring about, because I know they have other things to speak about, but we'll try and accommodate as much as we can. Boa says, Doc, all vaccinations are still test vaccines. Some countries must legally state this when offering it to people. Are the vaccines worth it? Is there anything better to do? Increase your immunity? That's what
okay.
we'll
talk about we'll talk about few of those things, like how to improve your immunity and how can you do it. There are so many things, like at the moment. So the best thing is not to get infected. Take all the precautions, and best measure is to go for vaccine at the moment, right? And at the same time, it's a multi disciplinary approach for this problem, even by our own self, as well as when it's come to the management of the patient, even at the hospital setup. I mean, it's not a like individual thing. So likewise, if you are fighting, if you want against the virus, and if you want to boost your immunity, so that's again not a one single measure. So you have to take each and every step from every corner, right? Precautions, and also mask wearing, hand sanitization, distance, social distance. And also, again, if you know that, we'll talk about some of the exercises that which we can do really boost your immunity. I mean, those are being proven against any infection, including viral infection, and also the vaccination. So why you think that we have to do only this one, and I'm going to do it? No, I think we have to take every measure. This is a pandemic. You can't just confine to the one or two measures and just stay and take some loose hands and the play around and now we are okay. No, absolutely no. I think even though this vaccine is coming, I don't think this virus will fade away from the world. It will there forever. So only thing is it's a vaccine. And if you go for a herd immunity, or if you do your vaccine about 60 to 70% of your population, the disease will control. I mean, if you can remember when we were children, right? We had only about 3 vaccines that given maybe with BCG, and also maybe maximum 4. But if you see now, even the children are given hemophilus vaccines and so many other vaccines. I mean, there were 6, 7, 9 the variant of vaccines are given to the children. So but they are disease free now. So likewise, in future, I think I mean, even the scientists are predicting that you can't have COVID free environment forever. So it will be there, but only thing is we have to rise against it with our all weapons, including the immunity, and also with the vaccines. Probably we might have to include our vaccines maybe yearly, maybe once in 6 months, we don't know. I mean, to stand against this virus in future, but that is, we don't know. Actually, we are looking at the future.
Yep, you're absolutely right, Doc. You reckon that in time to come, with, as you rightly mentioned, that the kids are given so many number of injections. You believe that in future that COVID can be one of the things that be given to the children. So there is perhaps in the long term.
Yes. Now I know, as you know, like some countries, like they are even in USA now, they have decided to go for even younger population now. And there are some studies going on even for because we are also coming out with some pediatric population, couple of cases, and not couple, I would say fairly high numbers also. And I think it's also in the state of some kind of trials, and hopefully I mean, entire population will be covered, because we don't know how the variant of concerns we talking about this virus, how they they behave, in which populations they will be most affected. So it depends on the how the disease is being behaving, and also how this being progressing
Control,
throughout
yeah.
the world. Yeah, we never know.
Right, Doc. That's before we move on to the main segment, the Mervyn just asked, is there any medicines that can be safely taken during the first 3 days of being infected to avoid lungs being affected or the immune system going
Right.
to a cytokine storm?
Yes, I think I can give some very good answer for all these questions. If you go to the slideshow,
Right.
Charith, can we upload the next slide?
Yeah, we can go on to, I think, disease of COVID-19 symptoms. Is that what you want, Doc?
Yeah, absolutely.
Okay.
So I'm just, I mean, I would like to share this very simple slide, though it's simple. I think all of you know about this COVID, and there are common symptoms. Like common symptoms are actually fever, dry cough, and you can see some shortness of breath, fatigue, absence of feeling of smell. So that is one of the things actually we have to really think about this. Especially the absence of feeling of smell. That is one cardinal feature in now the modern virus, and you can really feel. But you might get whole body fatigue, especially the dry cough, maybe mild fever. So you have to be very careful. Those are actually the common things. But there are some uncommon things, like you can get some productive cough, which is not very commonly found in COVID, and nasal congestions, headache. You can get some chills, diarrhea, because we have some cases, very rarely the patients just presented with only profuse diarrhea, right? It's a matter of suspicious, high index of suspicion, and if you check that patient, why is like COVID positive? There are some rare cases, right? So, and again, now you may have heard about past couple of years, past couple of months, that there are various syndromes associated COVID-19, so which we never heard about during the first or second wave. Now with the third wave, these are being reported, like you see this macroglacia, or we call it the bigger tongue, and so many other things. And sometimes if you go into the very severe situation, right, you get a very high fever, maybe you maybe cough with blood, and also some organ failure, coma, even you might get some heart attack, because it has been some newest articles been showing actually COVID, because of the cytokine storm, actually it gives you the heart attack, and 27% of about deaths are due to actually they're not the pulmonary causes, the lung causes, it is the cardiac event. So it's a bit of a concern now, actually, where you die not because of your respiratory problem is get compromised, but of course you have cardiovascular events, that is the heart attack. So if you go to the next slide, Charith, I think I can be give you a very good insight actually,
Right.
For all my audience, and I'm very happy to share this slide, because I think even if you are a non-medical person or a medical person, you should know about the disease pattern, because this is published in very recently 2020 paper. Actually, on top of that, two Sri Lankan actually researchers also involved in actually, yes, this slide show you a very good picture about this disease. Okay, the stage 1, they have categorized into stage 1, stage 2, and stage 3. As you can see, this is April 2020 the published paper. And especially if you, what you really should know at this stage, it is not the date that your PCR get positive. So it is the symptom that you are getting. So that is where the problem comes, right? If you get the symptom today, you might, just wait for a couple of days and think that then you have some suspicion about this and go and do the PCR. Then the PCR get positive, and your whatever the management is going from that point onwards. But that's not the case. We have to think about when your symptoms starters. So that is where actually this stage 1 early infection phases represent. So in that case, you can see the lower part, actually it is the blue color, it is the viremia, or we call it the massive amount of virus in your body system. Whereas, so in that case, you might get sometimes fever, the cough, which I mentioned in my earlier slide, that you will get quite number of actually with other symptoms. But remember, in this phase, if you do some blood tests, you will be able to find it out this some kind of a lymphocytopenia, because the lymphocytes is being getting very high, because any of those the body response to this particular disease, actually for virus, is your lymphocytes are the cells that which coming into play. So then you can see if you're actually the disease is progressing to this stage 2, right? So that is on that area where you will find actually the lungs are being affected. If you take some radiological pictures, let's say the chest X-ray or a CT scan of your lungs, and you will see the particular changes. But this stage, the symptoms are getting worse. That is the thing. So now you can see the viral amount of the virus in the body is getting down during this stage gradually. But remember, the body response to this particular virus infection is getting now higher and higher, it's getting mounted. So what happened, right? This is the area actually where we can actually do some treatment. What are the treatments? So they recommended very highly, actually, now don't take any other additional treatment, but we have some special, and if you feel that you are get infected, it's better to consult or get the specialist opinion. That's very important, because there we can actually treat you properly. So there are some drugs actually, I would say especially the monoclonal antibodies. There are some, the particular drugs where we have sometimes some of these drugs are, it's not available in Sri Lanka at the moment, but you can actually do some special
Thinking, I lost the connection with the doctor for a moment. I hopefully doctor will come back online. I think there is his line dropped. Can people still hear me out there? Just I can't hear. Actually can't hear doctor online. Can you hear us? If someone can give me a feedback whether you could hear me. I can't hear the doctor actually. And by the way, guys, I saw that I'm trying to enlarge the slides, but unfortunately my software won't allow me to upload the images. For some reason I cannot. Yeah, okay, they can hear me, but doctor is, I can't see doctor. I think doctor is offline. Hopefully he'll join us, and until doctor comes back online, that just to summarize, what we've been talking about for the moment, what he was simply saying, that there is no easy way out of this, the COVID kind of situation. What he so far what he said, that the best, the prevention is better than cure, and what he said was the best thing is to get yourself vaccinated as much as you can, and that's the only the solution we have in hand. There is no other alternative so far. PCR is the only tool that we have to identify the virus. There's nothing else. That and before he went off the line, he was that he was talking about the progression of the disease in COVID-19. I can't see doctor online as at now. Let me see where doctor is. Hopefully I can get doctor back online. I hope doctor is still around there. Let me call him up. I hope. Sorry for the interruption. Please be online, and let me try and get doctor. You are not online, doc.
Right. Okay.
I don't see you online. That you have to log in.
Okay.
Yeah, you will have to log in, because I cannot see you online. Just please, the people are still waiting to hear from you, and I'll ask them to wait for you. Please re-log in. Okay, all right. Sorry about it, folks. I think doctor is having difficulties, up in the hills. Probably the connection. Yeah, that's it, Mervin. Yes, I can't see doctor online. Just in the meantime, that just to see that okay, doctor is back online. Hopefully. Yes, doctor. Yes, you're back online, doc. You're going back on the mainstream. People are still waiting to hear from you. Yeah, good to have you back, doc. All yours.
Okay, right. Sorry
Where
for
did you stop?
those are the technical issues.
Yeah, that's right. Yeah, you're back online.
Can you hear me?
Yes, I can hear you very well. Yes.
Yeah. So if we
you are on the second slide.
Yeah, I don't know whether our audience can hear me properly.
Yes, they can. Yes, they can hear you. Yes.
Thank you. Yeah, when we talk about this slide, right? So when I mean, especially the stage 1, so we have these drugs. So I think you will get some very good insight about and especially there are some evidence like it's not a like kind of a very scientifically proven thing, But there are some small cohort, also small, the case report has been done. Vitamin C, vitamin D, and also the zinc has some sort of effect during this first two stage, especially the stage 1 and stage 2. But it's a kind of it's a case to case, the evidence, but not as a randomized trials has been done and proven. But absolutely you can take, but we don't know actually about this. There are some Ayurvedic treatment, and also the traditional things are there and believed to have improve the immunity. But no harm of taking all these things, because as I mentioned you, it's a multidisciplinary approach. You have to fight against this particular disease. The important thing is actually now when it comes to this stage, early stage of stage 2, and also the late stage of stage 2, and where the oxygen supply is really needed. And if you go to the stage 3, that is where actually we have to prevent going to this particular stage. So that's our strong advice from the professionals, is to don't wait until you reach the end stage of stage 2, or going to the stage 3 where the results are very detrimental and it's very horrible. Like if you go to the stage 3, you can see, because sometimes even if you do check, your viruses are not in your body, but the cytochrome and other immune the host responses, the strong protein, the response proteins are there in very high amount. And the cytokines, actually we call it sometimes the cytokine storm. That is the one actually sometimes that the patients are really hit their organs and their the entire lung tissues, maybe cardiac, the heart, and you will get bad. And that is where actually you might get, sometimes they go to the third stage, that is the host response stage, but with very high inflammatory markers in their body, and they recover, and sometimes they go home. But remember, there are many cases 14 days they are there at the hospital and the symptoms are relatively less, and you are doing your blood testing, you feel that you are okay, but when they go home in 1 week time, sometimes at home, or they are getting bad and they are on the way to hospital, or even they sometimes readmit and they die. That is due to actually this severe host response, actually due to the very elevated inflammatory and cardiac the damaging, or maybe the lung damaging the proteins in your body. We call it the cytokines. So remember, so that is the new picture. So don't think that the 14 days, or when you are symptoms wise you are okay, but still you are at risk. So that is the message that I wanted to give you. But unfortunately in Sri Lanka, sometimes most of these very the drugs, actually sometimes we have very specific drugs, the biologics and new things, but very few are available at the moment in our health sector. So we don't have to the facilities sometimes to give all these drugs. And there are some rumor going around that at the stage 1 or stage 2 that you have to take aspirin and antithrombotic drugs that will be preventing. But at the moment there is no evidence that if you are taking aspirin or any other blood clotting preventing drugs saving your life. Because if there are some the coagulation, that is the blood clotting cases are there, but you have to diagnose and you have to really confirm that you are developing these things. Then only, actually not aspirin, actually some enoxaparin, the different drugs are there, that they are the recommended drug at the moment. So therefore I think it is very important for you to understand this particular slide and see how these disease pattern is there. So other very important thing is actually I want to tell about something, red flag signs. The red flag signs are actually if you are a breathlessness at rest, if you can't even breathe at rest, or if you develop some chest pain, right, or if you develop some syncope, you're like when you're moving, you without with any notice, you just faint and you just fallen down, and it's a transient, maybe the loss of consciousness. So those are, and little bit of a you have to really concern about these red flag sign, and if develop something like that, no way at home, you have to go for a proper care center. And the other thing is actually if you're saturation, but now even if you go to even the normal pharmacies and many other places, you can actually buy the oximeters. I mean, you can put it on your finger and just check, because couple of years back, this fitness the watches and the fitness heart rate monitors are not very popular. But if you really see our sports people today, and many of people are just spending about 7,000 8,000 rupees, you buy those things and now they are wearing. But at the same way, like, you can even buy some small finger, the digital oximeters, and you can check your saturation. If your saturation is less than 94, so at rest, so you are in trouble. And if you just walk around 1 to 2 3 minutes with your, if you can just then if you see your capacity is less than 92% oxygen saturation, still that's another very dangerous sign, I mean, with other symptoms. So you can't manage yourself for having these very unscientific drugs, and also the taking some whatever the traditional things. No, it is the time that you have to think about your life and also to care about yourself. So that is it with COVID. I think
what you're saying is
Charith,
just before you move on to the slide number 4, just
yeah.
what you're saying is, even if you don't have any symptoms or anything, you're perfectly fine. You can still check your oxygen saturation. Is that that's something you got to do it on a daily basis?
Yeah, I mean, if you have it, if you have a digital oximeter, right, it's good to have it and see, right. That's good, right, because provided that there is no any other causes for to drop your saturation, so you have to think very seriously about.
Right. Okay. Very interesting. So I hope people. I think we lost a few viewers. When you went offline for a while, Doc. That's hopefully we can pick it up and they will rejoin. And sometimes that I think this uploading too many the slides, it can. I don't know. I mean, I'm not an expert on this. Just sometimes it can clock the stream. Perhaps that probably what happened. And unfortunately, I can't. Enlarge these stencils any bigger. I probably will have to do a follow-up and to try and upload all your the slides separately for people to have
we'll
a
see.
I think you better
yeah,
I think you better
thanks,
just carry
Charith,
on.
and I'm really appreciate. I know because I just wanted to give you some audio visual effects for the audience, for better understanding. So and thank you so much for your effort, and maybe we'll try our best to deliver the best information for the people. And right, impact on COVID-19 sports. So that's actually the topic today. So I would like to actually basically categorize this the effects of COVID-19 into the sports arena largely in 4 segments. The number 1 is actually it's sports management. Number 2, it's training and physical qualities. Number 3, psychological impact of the COVID-19, because that is one of the areas that we have to really mismanage even in our setup. I don't know about the rest of the world. All right. And social and other effects. So when it's come to the first thing, that is the sports management. So what has really happened to our sports? This has gone through 4 main issues. Number 1 is the relocation. So we know that we had some, the last cricket tournament against Bangladesh. And I mean, in normal situations, what happened? There maybe one match is played in somewhere in Goal, and the second match maybe in Pallekele or any other places. The venues are going to be changed. But what happened? Everything has to be relocated now, right? So the location is being changed, and there are some interruptions. So what is happening? Like, I mean, what are the interruptions? I mean, the recent, the very good example is the IEPL. So they have to cancel they have to actually cancel, in the sense they have to stop the tournament because of the rise of cases, and it's a bad situation in India. Even though they are in the bio bubble, but they have to cancel it. And the other thing is the partial cancellation, but actually this is a partial cancellation, and we know that even the Olympics this time, ideally, planned to do it in much earlier date, but they have cancelled it now, partially cancelled, and now they are going to do everything in due course. So sometimes the total cancellation. So in partial cancellation, actually now what the IPL is going to do is actually now they are going to play the rest of the tournament in some other location. So that is, that this process is being actually this is belongs to the sports management, but I wanted to mention even in my talk here today. So these are areas where we have to think in a large manner when you are involving in sports. Maybe we don't know whether it's a national or even a junior level. So some sports specific activities are being really affected, because even if you do your exercise schedule at home, but you are not in a environment that you can do the sport specific activities, right? It's maybe a very confined, maybe limited resources that you are really using and do your basics training, or you just wanted to maintain your fitness, maybe basic strengthening and the conditioning, but not the ideal the environment. The other thing, especially when it's come to the team strategies, so this team chemistry is being missing. So I mean, as you know, like it's a team sports. The ultimate, actually the outcome, it's mostly depend on how this team chemistry, and also the game flow, and because the understanding each other, how they react, and also to get that whatever the team spirit that they of the day. So those all things are being now being interrupted or maybe stopped. And when it's come to the training and physical qualities, there are both quality and quantity, both are being affected. For an example, like the number one problem is actually the frequency. And if you say, I mean, you are not in a way that normal routing training schedules are being done on particular days, that it is very well organized in a periodization, the program, and then all are disturbed now, because the mostly affected part is the frequency, that how many days per week that you are attending your training sessions. So we know by principle, if you disturb your frequency, that is the number one factor that player can go under training, or if it is going back, and if the frequency is very low, that's mean if you go into the complete cessation of your activities, you will end up in a detraining situation, which I'm going to talk little lengthier, because it is not very familiar to many of us, especially the people who are in the sports field. And also the time that you are training with your higher professionals, like coaches, maybe strength and conditioning professionals, and also with the physiotherapists, with other high performance coaches, trainers, this every this intervention to your training is being now missed. Now you can see the problem, because there are restrictions, and especially by and large. So what is the end results? End results is all the training qualities. So you are doing, all our athletes are doing the training for to achieve many components of their segments. For an example, aerobic fitness, anaerobic fitness, maybe they are strengthening, power, speed, and especially the body weight. That's the biggest problem now. The many athletes, especially the junior, the group of athletes are now facing, because their body weight is really going up. I have seen some concern about this also. I just wanted to highlight, because there is a there are like evidence. Actually, if you gain your body weight 10%, and your performance, each and every game today has a standard the body composition. I would say body composition is not the body weight, actually body composition. So that's very important for them to maintain that particular body composition. But if it is being altered, so there's a 20 to 15%. These have been like really proven by the research. 20 to 30% reduction of your performance level. So if you increase your body weight 10 to 7%. So that's a big concern, because the problem is actually when you're at home in the governed lockdown situation, but your physical activity and your training or your burning part is affected. So what happens is you will not think about control your meals. So automatically that excess energy, which is being not used on regular training days, being accumulated in your body. The best way of accumulation of this extra energy is convert into fat. So that is where actually you develop your unhealthy body composition. The body composition means it is your fat-free mass to fat mass, the percentage. That's very important. So weight, actually we think about the weight in a different manner, right? If you can maintain your fat level, and if you get your lean mass high, so your weight is okay. But the problem here is the body composition. That is your percentage to your fat mass to the fat-free mass, which we refer to as the lean mass. So that's a one big area. And we have observed, especially how much you do your normal strengthening program at your home, but each and every sport has its own specific strengthening training, right? For an example, you might do gym training and you are a soccer player, but you have to do a soccer specific strengthening training for you to develop that specificity. So therefore it cannot be done at home, domestic setup. So we have, like in 2020, actually seen the scientist who has published a paper in the BMC. Actually it is an open access paper, even you can read it out. And he said there's a 30% reduction of sport specific strength training even in the players are engaged in normal strengthening program. So that is where now all these our coaches, trainers, and even athletes are take care and consider. So other than that, actually this most of the sports are based on their hand-eye coordination. If you take any racket sports, even in cricket, because you need to have a very good hand-eye coordination, which is sometimes not being trained in our local athletes, right, as a specific training, but those hand-eye coordinations are developed through their training specific for that particular sport. But if you don't do these particular training sessions, your hand-eye coordination is gradually dropping down. The other problem is the reaction time. So that's another thing, that's a very important thing in sports arena. So the reaction time, actually you have to really activate throughout your body to maintain your reaction time. With your age, the reaction time is dropping down. We know all these factors, but remember, if you are in a lockdown situation, if you are in that particular specific sport, your reaction time has to be maintained. So there are different devices, right? And there are even computer generated programs. We'll try to elaborate few of these things, and in future, like, how we can do. So on top of that, actually, now the other problem is actually the psychological impact. So your stress management, right? Your leisure time, because every sports person and a normal person need to have the leisure time and the enjoyment. Sometimes, you do sports or maybe the physical activity as your one of the hobby, but unfortunately that time is gone. But even though some of the top athletes, maybe their hobbies they cannot continue, maybe going to wildlife, maybe photography, maybe going on maybe traveling to other countries destination, and this all things are being affected. And the biggest problem is actually the inhibition of our psychosocial interaction. So you can imagine, because human being is, I mean, if you see the evolution of human being, right, the man is actually his behavior is in a social, the groups. We never found in the history that the man is a very isolated the animal who just live in separately. No, they get together and they live in civilized the as groups. But what happened now, when you have the lockdown situation, that interactions are being disturbed or completely even that you cannot go to your, maybe to see your parents. Now you have been for so many days inside your house, right, in your own environment. Sometimes you feel it. And they have done, actually, in this research has been done, and especially when it's come to the athletes, there is a 70% drop or decrease the level of motivation to train. This is done in USA. So you can imagine what is really happening even in our setup. Actually, I'm premature to tell now. We are actually doing some of these the targeted few research on these days, but we are yet to publish these things in the next couple of months. But we are in the process of some data collection, and we also wanted to see what is happening in our setup, but in a scientific manner. And the other thing is, actually, there's something called training satisfaction score, right? That's a very the remarkable and also scientifically proven marking scheme of to see the response of your training for sports. So they said it's about 60%, 60 to 70% reduction or the lower training satisfactory score. That's another area. So there is something called, actually, I'm telling a little bit of a medical jargons and some of these facts. Sorry, that I think everyone will not be able to understand, but I think it's we wanted to tell on this particular information to you. There's something called visual analog scores that you can do. Actually, using those things, you can do the emotional well-being of people. Especially they have done on athletes. Now it is 50. 50 is, I mean, we expect about 67 to higher scores, but now it is going to very low level. So some other specific the problems actually happening because of that. Actually, I've been informed by many trainers, because their only income source is this sports, but all these things are being now disturbed, and they are having some other problem. And special population like youth, and especially the disabled, like differently able athletes, now they are in deep trouble. And the other thing is, now because of this lockdown, and also the not without having proper training, now we have actually some evidence that there are some specific injuries, especially the Achilles tendon injuries, hamstring injuries are being noted among the athletic population. So I think those are some alarming things. Actually, now we have to take some proper action, proper thing. And the biggest thing is, now we have come to a new normal situation because of the COVID. Now it has happened, it has affected to make all these alteration of the sports training and sports management strategies in future and even the current status, because we have developed this biobubble system to protect the athletes and also to continue the games. But as this is only happening and in a very high level or the national level athletes. But what is happening to the junior levels? And as because the newest study done in Australia again about the youth population in 2020, that's Elliott's that's the scientist actually who published this. They have found it out, and this issue is now even among our players as well, because the under 16 and under 18, the players who are playing at the moment, now they are 2 years, apparently almost 2 years, they don't have the tournaments going on, especially rugby and also even some of the crickets and all this. Because now what happened, the players who played the first 15 or supposed to play the first 15 also didn't have the the matches or the game experience, training and everything, anything during the last maybe 1.5 years time. But they are the potential athletes who will be representing the national level or maybe the club level, that is the highest, or the elite level, the next stage. So what has happened, these players did not have the exposure, and they are aging, they are upgrading into the next level. So it's kind of a the very situation where we have to think very seriously how these players are getting mature and also to upgrade to the national level without exposure. So they have found actually even in Australia, right, even in club, and this missing the opportunity actually for these particular age groups, especially the athletes who are willing to go for higher performance and the elite level, are being really affected, because very small percentage only that they will have the chance to go to this training and complete their sessions. So therefore actually there are some other principles actually I don't want to highlight too much. This in athletic development in youth, they go for 4C and 3P's concept. As 4C is competent, confident, connection and character, and 3P's stand for performance, participation and personal development. So these principles all are being now hit by this particular COVID the situation. So actually now all these countries, especially the top sports countries like USA, especially Australia, maybe in China, but now the officials are really taking care of, and they are really considering about this the new problems which they are going to face in the next couple of years. Now they are taking all their measures actually to planning their strategies. I think now even in our local setup, now it's high time to think, right, which is nothing happening at the moment at the bottom level, which we know personally. So it's only maybe the national few teams, or the very handful number of individuals, players only getting some kind of care, but the rest of the people are not in line.
Just to interrupt you a little, Doc, what you're saying, it's understood that what is happening, it's only, I think it's all around the world, and you as you rightly said, only the elite players playing that at the highest level have the opportunity to perform in a bio bubble and all that, and the rest of the guys who are in the feeder system don't have a opportunity to go out there and perform. Just to ask you, all what you said about the athletes, what is this COVID impact on the normal people? All those factors you said, psychological, physical, the eating habits. What kind of impact? You said that we are social animals. We are not meant to be caged to sustain in a contained environment. That we are not supposed to be caged. Now, what is the impact on normal human once someone you lock a person down for 2 weeks? What would be the impact of that person when you come out of a lockdown?
Yeah, that's a very good question, Charith. Very interesting. Okay, we are talking about a little bit higher level, but if you take the normal population, so the same scenarios are being applied very clearly, like the psychological impact, especially the isolation and also the lack of the human interaction, that all cases, and as well as especially the country like Sri Lanka, there are economic situations also mounting a lot of stress, and also the psychological the impact, and also the some kind of a depression, and the especially that's what sometimes we can see that there are reactions, sometimes the domestic reactions we can see. Actually, we are getting some calls from some parents, their children's also very aggressive, sometimes they are not listening, and maybe very difficult to control them, and you can't this normal day-to-day activities being disrupted, and their peer association is not there. So a lot of the negative impacts are there when it's come to this particular living in a contained environmental. The other thing is actually as you said, clearly mentioned about the nutrition, because that is where the biggest problem comes. We now see, because if you see the how this lifestyle being changed from the normal to this particular special situation. Now, if you take your daytime, you might be sitting on a chair or watching television, or maybe on your social media or something, the more than ever, because now it's happening so even if your kids and even some of the professionals are doing their online programs and sitting hours of their screening time has been improved. And we know that screening you have to, it's a world WHO recommendation is to limit your screen time and also to move yourself around. So what has happened, because of the bad nutrition plan, and also you are not controlling your nutrition, that is the biggest problem, because we used to take the same amount of the food without doing anything. We just stay around in a very limited and space, as well as the limited movements. But people are not conscious about control their meals. They have to reduce your calorie intake depending on your the expenditure. So you have to very clearly do it, but that can be done very easily. And what you have to do is actually you reduce your carbohydrate amount. You need sometimes, yes, of course, I agree, because you need to go for a proper dieting plan. But if you cannot contact with a proper nutritionist or diet, at least if you can cut down, especially the Sri Lankan diet, very high amount of carbohydrates. If you are taking a traditional Sri Lankan diet, it's about 80 to 90% of carbohydrate is there. So you can easily cut down 30 to 40% or less than 50% of the carbohydrate in your plate on daily manner, and you will realize how comfort you are and how much weight that you can reduce without even doing a single bout of exercises. Because 80% of your weight management should come from your kitchen, not from your gym. If you see your energy expenditure, right, so of your body, actually your metabolism take about 50%, maybe 60%, and your the rest of the 10 to 15% of your energy is actually wasting for your digestion of your food, and about 20 to 30% only that you can burn by doing your physical activity. So people think by doing only the physical activity in a strenuous manner, then you can reduce a lot of weight. No, absolutely not. Sometimes if you don't control, if you don't balance, that is why it is very important. If you can improve by doing your exercises, you can improve your metabolism or the metabolic rate of your body. So you can actually, that's a one way of doing weight reduction. But that is not the only thing. You have to actually, if you take high protein diet with less carbohydrate during this period, so that is very important, because for you to digest your protein, the body need to develop a lot of heat, and it takes a lot of energy. So by itself, that's why sometimes we recommend some high protein diets for people or the athletes who are doing some figure conscious sports, like figure skating and maybe gymnastic, we wanted to, have a slim bodies. So the high protein diets actually promote your body, but you cannot get rid of carbohydrates. But of course, you need to have about 50 to 40% of carbohydrate in a normal diet. But remember, Sri Lankan traditional diets, it's about 80 to 90%. So you have to really think. I mean, these are very general instruction for you. I'm not talking about, talking about nutrition is another separate subject. We need to, we can do it in a different forum if everybody's like. So that's one of the areas that we can really talk about. But if you take this whole scenario, then by doing strenuous exercises or maybe spending, it doesn't really, it give you a certain amount of weight reduction, not up to the expected level. So that is one area. And the other thing is actually what I wanted to highlight. So during pandemic period, I told that very clearly that your exercises can boost or increase your immunity. It's very obvious. We know that. Everybody knows exercise can be a tool that you can use during the the pandemic or non-pandemic situation, that for you to boost your immunity. So, but I wanted to highlight two things. One thing is, if you are doing moderate exercises, I think I don't know whether you know about this, how to gauge your intensity when you are doing exercises. Charith, we have a small slide. If you can just show it to us, that would be really, really helpful.
Right. If you could tell me the number, I'll try and see whether I can dig it out for you, Doc. Something that before we move on, which could you tell me what the number of the slide is?
Just hold on.
Doc, just to ask you, I know some people that the people who work online, and some of them they clock in at 7:30 in the morning and they are stuck in front of a computer till 4:30 in the evening, and they just grab they eat whatever they can they can lay their hands on. And you said that spend less amount of time, your screen time, it's better for you move around and cut down the carbohydrates. But at the moment, some people are hand to mouth and they don't have an option to buy the required amount of proteins. How do you manage that?
Two options. It's very obvious, right? So now you're in front of the screen on a sitting on a chair. So you have to change your position, right? Very clearly. Now they said smoking equals sitting.
Smoking equals sitting.
Absolutely, right? The sitting is one of the most risk factors now identified to give your that is the non-communicable diseases. So you have to reduce your sitting time. So what is happening in some part of the world today? Now they have identified this fact. Now they have changed their screen position. So what they have done is actually they remove all their chairs, and now we have to work on a standing position in front of your screen.
Wow,
so only thing is just changing your position. So if you stand for 6 hours per day, right, you can easily burn about 100 to 200 calories on your body. It's like almost like half and 44 minutes workout in a gym, right, without doing
just merely standing a couple of hours for a day.
Absolutely.
Right, okay.
Now if you go to the Singapore and many other the countries, now their kids, their library time is standing reading time, because they removed all the chairs from their libraries. Even in the many offices, even in the high class executive offices, there's no chair. The only chair is for you to sit for about maybe 5 minutes, 10 minutes. You work on a standing position, right? For an example, like the medical doctors who are going by 8 a.m. to the hospital, sometimes they finish their ward rounds by 12:30. They just sit for about small tea, whenever time permits, only around 10:30, maybe 5 minutes, and they again go back. I mean, if you are doing a ward round for about 4 4 hours, standing. So there's a huge amount of calories, burning. So that's one way. You just change your behavior, change your attitude, and get the maximum use of that. I think we as responsible people in future, actually we are going to suggest to the system, change all these things in very near future. Start it from the school level. And there are so many bad effects from your if you are going into your screen. So screening has very bad thing. I mean, they have scientifically proven. So you have to actually, if you have your cellular phone or your computer, whatever the display device, your screen, you should switch into your blue screen mode. That's very important. There is a function. Remember, you have to do it, right? Otherwise, your eyes strain, and the bad effects in front of your screen is mounting, and it has very detrimental effect. The other thing is, they strongly advise before your sleep, at least 1 hour before your sleep, you have to get rid of your screen. That's extremely important because it affects your quality of your sleep. And we know that our sleep is not just a sleep. It has certain stages, right? It has rapid eye movement, it has slow eye movement, and there is a deep spaces, because each of this cycle has to be continued to have a complete sleep. Why we are sleeping? It is our biological clock is being activated, not just that it's becoming night or day, because our body has biological clock that is being actually now altered. I know that even this COVID period, right, and the kids doesn't have anything to do, right? Even sometimes the people who are in the houses also nothing to do. They wait until 2 a.m., 3 a.m. because they wanted to have their nighttime data, and so many things are bad there. But they wake up around 10 o'clock, 9 o'clock, right? We don't know how long that we can go, and we have to really think about these things, whether disturbing our biological clock. So if you are disturbing your biological clock, what is happening? Because your entire endocrinology system, your hormone, your other systems are being going to affect your nervous system. So we don't know the long-term effect of these things. You know that if you get a liver failure, first thing is you feel sleep in the daytime, and you are awake in the night. That is one of the earliest things in the liver failure. So if you, I mean, we don't know what would be the the results of these things, but long-term effects, it is happening all around the the country and the places. So so we have to have a lot to think, and also get the very clear facts and figures, and also the scientific details to address these events in future.
Doc, you scared me when you said that. Perhaps after this chat, I probably will have to come and see you, because I thought I always, I'm a useless morning person. My body doesn't actually really function during the day, but my eyes starts opening no sooner the sun goes down. So I thought that's the way I've been. I'm not a morning person. Now that you said that, probably that's the first indication of liver failure. That gives me the goosebumps, Doc. That's
No, actually, because provided that you don't have the liver problem, so that's not a problem. But as you said, there are people, because they have their inherited some qualities. There are people who can just very active in morning hours. Some people are just the late night people. So that's normal variations. But I'm talking about some extreme situation.
But Doc, you said maintaining your biological clock is vitally important.
Absolutely.
For people during this time. So you reckon that you continue the routine you had despite what is happening around you. Try and get hold of it as much as possible. And consumption of what's your idea? I know some people. I know that your Doctors Guild or whatever the association contributed largely into this, knocking down the bars. That no alcohol. And I know lots of people who are starved at the moment. Is it a good thing or a bad thing, or can that lead to any other complications?
So it's how you like the define alcohol consumption and human behavior is a very complicated thing, right? So first and foremost, what I wanted to tell is actually alcohol, I mean, from the baseline, it's not healthy things for our body, right? If you take excess amount of alcohol, so that is the number one advice. But only thing is now what has happened, actually there is a high time that we should find some other ways to make our the fun time to relax and all these things. What most of our people think your leisure, and when you want to relax, the mode of relaxation is alcohol. Now that's the problem here, because there are some countries I visited and they have zero alcohol in their societies, but there are so many options that they can really they enjoy, they really they actually their leisure times they are spending in a very worthwhile manner, which we never thought of. So that's a one area. And other thing is actually the alcohol is basically a depressant. It is not a stimulator. So many people think that it's on the other way, but I would say, but only thing is you cannot get rid of alcohol because of the cultural and so many ways, and it has been practiced many years, but only thing is you have to have the understand. And the bad effect of alcohol, we know that it is a mental depressor, and you might be adhere to then and then the other thing is you will be dependent on alcohol, which is a very bad thing. And also the health hazards of alcohol, including the worst thing is the alcohol cirrhosis, and there are so many other things, because your memory power, the brain functioning capacity, and also the other organ damage, long-term use of alcohol, especially your nerve system malfunctioning. So many things are in the list of alcohol complications. So but you have to really think, I mean, if somebody who's addicted to alcohol, I mean, this is a good time to think, right? And also get rid of this the problem, and you will feel that you can live without alcohol. Some people think that without alcohol you can't live, but as you said, there are some recommendations, and we never say for patient okay, you have to control, so this is the amount that you can go, because it's you cannot get rid of this problem.
Yeah, well said, Doc. So you wouldn't even advise in moderation, alcohol is zero, is that what where you're saying?
Yeah,
that's the best way?
Yeah, that's the thing, because nowhere in the world, because they said it's a zero. If you can go for zero, that's good, but only moderation, and people who are consuming it to encourage them to come for the healthy level limits to maintain.
I know, Doc, we have a lot of things to talk about, and I mean, you have not even, probably we have to go to episode 2 sometime later. We have been talking for the last 1.5 hours or so. Doc, I know some of the countries, I don't know whether there are any we had some viewers from Canada a while ago. I don't know, I'm not too sure that they're still around. Yeah, she is, Dashi. She has been in lockdown for almost 1.5 years, those countries. How do you think, that how Dashi, she's a professional athlete, that
Sorry, I didn't get it, Charith?
The countries such as Canada,
Yeah.
they have been in a lockdown scenario for the last 1.5 years or so. And if Dashi she's a professional athlete, it's amazing. She was one of my guests, on the show, and she kept on training, and she never gave up, and I think she has done 90% of the things that you've been talking about humanly as possible to keep herself going. But the one thing I think she was really struggling about the mental aspect, how hard it is for her, the human interaction, that she was missing it. However much you train at home, it's not the same that when you go to a gym, or just especially that training with your team and all that. Doc, what is your view, and can we go on depriving, because at the beginning you said that that even the scientists, the doctors, everyone has said, as a society we have to learn to live with the virus. There is no other alternative. I mean, isolating ourselves, is that the solution? Yeah, we have accepted vaccinations, yes, probably short term. Prevention, yes, but can we go on, that's like with these travel restrictions, the lockdown, curfews? Is it really effective, or we don't know? We don't have we haven't done enough research on that this particular subject? Or can we have, I mean, like worse repercussions in couple of we spoke about what kind of repercussions it can have on sports, what kind of repercussions it can have on general public.
Yeah, because it is in the talk of debate. Actually, now we have to like really think of every aspect, not one aspect. Like if you see the physical, the mental, the economical, the social, and all these things come into play. Because now what we are going to do is actually now we have to, anyway, whether we like it or no, we have to go through this new normal life until the problem is come to a level that where we can actually compensate or compromise ourselves and restart. But I think, even in my opinion, the restarting the before COVID almost normal life is still a questionable thing, but still possible with the future, like whatever the scientific development. Because I think we had experience, the human being has experienced nasty things, even this kind of the pandemics, even in the past, but they have the recovered. But I think it's like that. It's at the moment we can't say when, but you can see in certain the part of the world now they are becoming near normal or a new normal situation. So we have almost always, you should not give it up, and we have to continue our whatever the all possible measures, and in a very positive manner. That's the importance, right? It's not easy sometimes, I can tell, very on a very casual way, that okay, we have to be very positive and do, but this positivity and also the psychological impact, it's different from person to person. It's very individualized thing, but you have to, but really, because that is why the professionals are there, that is why the psychologists and also the counselors and the medical people and many people are there to support in any, and if you are deprived of your physical conditions, there are people to help.
Now, on that note, that Sumali had been, she's all the way from Kenya. She's been writing. She's a qualified yoga teacher, and there are so many people who had, said so many things. We'll quickly run through that. What she's been saying, if you go through her what she had been writing, she has like a total holistic approach to the whole scenario. What do you think of, having like a yoga kind of adopt? Is that a good time to adopt to yoga and practice yoga?
Absolutely, because now you must understand actually the outcome of yoga and what is yoga. And I can see that she has recommended. I can see her note that she has recommended this Swiss ball or the gym ball to instead of chair. But that's another way of activating your muscles. Certain the group of muscles in your body.
Right.
It is a good thing, right? Rather than sitting on a chair, but only thing is, right, so you just move certain part of your body. But imagine if you are standing, standing is cannot be done with a one group of muscles. These our entire body, if you take the neck muscles and from the facial muscles to the front and back muscles, and if you take the gluteal muscles and also the hamstrings, the quadriceps, the anterior muscles of the leg, and also the calves, these all muscles are interactively antagonist and agonist muscle interactively actually take part to maintain your posture when you are standing up. right? So you can burn a lot of energy more than what you think. And the good thing is, actually, even if you are sitting on a Swiss ball, yes, you can activate certain muscles up to a certain extent, I would say, right? But why? Yes, that is also, you can do, but I would say, but you have to go for maximum, the possible way. I mean, you can do in combine. I mean, for certain period, you can allow her to sit on the gym ball, and over the rest of the period, yeah, why don't you stand and do your work? So very small things. And the other things, what I wanted to tell you before I wind, I think NEAT. What is stand for NEAT? That is for non-exercise activity thermogenesis. NEAT, non-exercise activity thermogenesis. It is now in the limelight now, in terms of, the burning your energy, unwanted calories. So we know that, if you are just doing some day-to-day work, let's say if you wanted to do some gardening, but in a bit of a strenuous way, you can burn a lot. Okay. And if you are standing, that's another the component in this particular was. But remember, if you are, while you are eating, right, if you like, if you can eat some chewing gums, right, if you eat your meals with proper chewing, especially these masseter muscles from either side can burn a lot of energy you may never thought of before. So that's what my advice is. Our most of people who just finish their plate within 5 minutes time, but their parents or maybe the the person who cook for about 2 hours, they finish the plate within 5 minutes time. That's a very bad thing. So take some time and chew and activate your masseter muscles. You can burn your a lot of energy we never thought of, right? That is called non-exercise activity thermogenesis. That is NEAT, right? And also stair climbing, right? So that's one good way, right? So many other activities like just walking, right, standing. So those are all come under this particular theme, which is being also advised. And also it's a very good thing actually to practice more than what you think. So
it's very interesting. I mean, as you rightly said, I was going to ask you about something that I haven't done, not much gardening, that I picked it up and I enjoyed very much, in the sun, unlike I can see, thank you very much to all those people. I can see lots of people, Singapore, Canada, and Major General Nimal Krishnaratna. Thank you very much, sir, for being a part of the show. We are fortunate in this part of the world. We got plenty of sunshine, and that you go out in the sun for a couple of hours, I think your burning of energy, perhaps it's much more in this heat, extreme heat. And I love gardening, and then I have learned to sweep the whole garden in both ways. I have realized it's like one of the best co-exercises that I have. It comes to you naturally, just sweeping the garden. That's nothing great. These things you don't need fancy gyms, you don't need fancy gym equipment. Just and also like just go groom a tree, do something out there. You don't feel the time moving, and you are in unison with the universe, and that's automatically you have spent a couple of hours out there, and without your knowledge, you have been standing for 2-3 hours, probably that you end up burning 1,000 calories, and that's what you need. Get out there, in the sense that you don't have to get out of the house. If you can spend some time out in the garden, perhaps that's the best way to go, Doc.
One other example, I mean, take your own car and try to wash it and do all these things these days, at least once in 2 days or 3 days, and you will realize how hard it is. The bigger the vehicle, you can spend more energy.
Very interesting, Doc. I wait for the rains, that I'm too lazy to wash my car, so I wait for the rains to come and I take the car out. From tomorrow, I hear you. I wash my car. I know it's not easy, and it's a very good way to keep yourself occupied and burn some calories. So, Doc, in a nutshell, if you can, I don't know. I mean, there are so many other things that we need to talk about. So, for sports people, I'm just trying to sum it up, that I think it's very important. You said that, maintain your body weight in a nutshell.
Yes.
That please, what they have to do, that to ensure that you don't put on excess weight. Intake your carbohydrates intake. That's
That's a
massively
very
important.
general advice, actually. Yeah.
Regardless whether you are a sports person or not, for everyone, cut down your carbohydrates up to 40%. You said, right? As much as possible. Try and increase your proteins. Yeah.
Yes.
And less time sitting.
Absolutely.
And
Move
you
yourself.
said stand, walk, as much as possible. Move yourself, and wearing the mask, for a longer periods of time. Say that your advice is, if you are indoors, restrict the amount of time that you wear your mask, isn't it? That's what you said.
Yes, which is a positive thing.
Yeah, and also you said that if you can buy a oxygen monitor or a saturation monitor, oxygen, it's very important, just to keep a tab on it. That's what you said. Yeah. And also that, the best advice that you gave, prevention, that's, take care of yourself before you take care of the others, and vaccinate. And before you, Doc, there's a question that I was going to ask you. In Sri Lanka at the moment, that that we started using the AstraZeneca, and I think that's the first vaccination that came in here. And then from there, then we moved on to Sputnik. I'm not very sure. Perhaps you will clarify this, whether Sputnik is approved by the WHO. To my knowledge, which is not as at now. The Chinese vaccination, WHO just approved, and of course, we haven't got Pfizer's and the Johnson and Johnson. It's not here. Probably, in our condition, it's not very, it's not practical to use those vaccinations. My question to you: does it really matter what brand of vaccination you take, and that you take anything that you have access, or you wait until that you get like one of these branded vaccinations? What do you think?
No, it's like that, Charith. I think a very straightforward answer for your question is, right. So I don't know the what this kind of concerns are there, because you have to think about all these lines, right? When are you going to get particular vaccine? It's not the matter now. Whatever the first vaccination, the opportunity that you are getting from government or any other sources, I think you have to get it out, right? Because at the moment we are in a hot plate, right? You can't mark your time and the wait until that this come. Then we never know that these new variants are coming on in different forms, and that there are hazardous effects to the body, and also to damage and causes death in the societies. We don't know, and we know with past couple of the maybe months how this COVID virus is behaving in different parts, and also there are genetic variation and also changes. So I think my personal as well as the experts' advice from the WHO and all other, even the local bodies, is to actually get your whatever the vaccines, because what you should know is actually these vaccines are made up of different the forms of vaccines. For an example, the AstraZeneca vaccine is actually non-replicating viral vector, right? So Sputnik 5 also the same, and also the Johnson and Johnson, that is the Janssen's virus or vaccine, also the same form, that is we call the viral vector. Whereas in full virus vaccines are there, because it's especially the Sinopharm is kind of a that is actually the full virus is there, so that will be injected into your body. And if you take the Pfizer and also these other Moderna vaccines, and these are actually the RNA or the mRNA vaccines, right? So they are actually the way they act in your body is different, right? But ultimately, the final results is whatever the way that it comes to your body, and ultimately your immunity is going up. So it's like that actually. If you want to hydrate your body, right, you should not rely on only water. You can drink the sports drinks, you can drink tea or coffee or something like that, right? And you can drink fruit juices. It's like that. But ultimately, what is your goal? Is to actually hydrate your body. So by taking these different vaccines, right? So only thing is, my advice is to all the people, because you should think about the economy level and also the other background of the the countries like us. I think even sometimes the places like USA, they have excess amount of their productions, and they can even have the the maybe stocks can be even given to the double the population of what they are having. But our case is not the like that. So therefore, my strong advice is to actually, you have to take your first vaccine. So the vaccine production in worldwide also now in a problem, because they can't supply for the demand. The huge amount of the millions of vaccines are demanding from each and every country, right? There is a shortage of to supply for the demand. So we have to understand all these facts. And my personal advice is to, I know that if you wanted to buy the best car today, right? If you want to buy a Rolls Royce, right? You will not be able to do it today. But if you can get a small version of vehicle today and get your, the whatever the traveling purpose is being fulfilled, till you buy a good one, that is more than enough, right? That day will come. So we'll be able to get the best vaccine in near future. But at the moment, so we have to, come into and think rationally, and also protect yourself. The only way of the protecting is vaccine at the moment. There is no other scientific proven method. So please,
Doc,
right?
yeah. So what you're saying is, regardless of what vaccination that is you have access to, take it.
Take it.
That's the first step.
Yes.
So my second question to you is, same vaccine related, that the people who have taken, say for an example, the people who have taken AstraZeneca, and now that the period perhaps has lapsed, that they were supposed to take it within 3 to 4 weeks, and now the WHO is saying it doesn't matter, that it can extend up to 6 months or whatever. Could you take say for an example that Sinopharm, the second vaccination comes, if you have taken AstraZeneca, the first one, could you take the second booster from some other injection? Is that possible?
It's like that actually. Now this kind of mixing of the vaccines are being in the process of testing. So I think there are some positive results are there, but we might have to wait for the exact results when these things are being coming out for our hands very soon. I think the way that some tests are being done on these combination vaccines injections pending actually now. Actually, we are waiting for that. So we don't know at the moment. At the moment, what the process is actually, we inject the same vaccine as the second dose at the moment.
So
we
what
don't
do you
know
do
whether this will come in next 24 hours. We are hunger to see it. Absolutely.
So what do you do if you don't have access to the second one? That if the recommended period has lapsed, where do you
it's
stand?
like that. That's a problem. Actually, that's a problem. Then at the moment, I personally, if I'm getting a very strong advice or the reliable sources, maybe scientific information, this is my personal will. I'm not going to have it my second one, because we don't know like actually what is the reaction. So what is happening?
So what you're saying is, that if you have the option, you take the same brand. So if you have taken the AstraZeneca, the first dose, you got to take the AstraZeneca the second. And if you have taken the Chinese Sinopharm, you got to be the same thing, because you don't know what the others are.
At the moment, because there are some trials are going on. I think because, these things are being actually now more than what we think. This, in the research, these investigations are really happening. Because it's a very people, the scientists are reacting and testing all these things. I think we are looking for some positive news in very but because there are some thing is actually there are some positive things, as I mentioned you, because the But the action of these particular vaccines, some form of vaccines are the same, the format. So there may be high possibility that you can get the same format vaccines. For an example, as I mentioned there's the viral vector vaccines are like Sputnik, that's the AstraZeneca, and also the Johnson and so the Jazzer. So there could be like, they can be, mixed because it's the same category vaccines.
Right, Doc, before we wind up, just my perhaps, one of the questions, Doc, realistically, if a person contracts, you spoke about, the symptoms, the initial symptoms, that what you can have. I think, it's very, very obvious that, that you can't run away from this virus. Correct me if I'm wrong, Doc. At some stage in your life, you're going to get it. And if you get it, what's your advice to a person who's found COVID positive? I'm not talking about asymptomatics. I don't think, you do really have to worry about the asymptomatic. If a person, has symptoms, like severe diarrhea to whatever you mentioned, losing your senses, taste, smell, what do you do? What's the advice you can give it to a person?
So in because now this is a pandemic, right? And it's a very infectious disease, and the new variants are very spreading, without more than what the amount that you think. So therefore, my personal advice is actually now we have to inform to the the authorities. That is, we have our own public health inspector, and also the the relevant maybe the institute, maybe the medical officer of health. So there are appointed the people, the medical professionals that you can inform. So then best thing is then the prevailing situation, like there are guidelines they have very clearly given to you, right? If there is a facilities, if you have the facilities that remain at your home, like you can be easily isolated from the rest of your family, having a separate room, separate attached bathroom, and all the things can be done separately. Of course, with minor symptoms you can stay there, but that is not the main recommendation. But asymptomatic people, that's a fine way. But if you develop some symptoms, you have to staging your the disease, as I mentioned, whether it's a stage 1 or stage 2 or 2A or 2B. So where actually your management protocol is entirely different. You cannot manage by yourself, just monitoring, right? There are so many incidents because they have keep shut, and they trying to stay at their houses. Ultimately the dead body is being taken to the hospital, or maybe on the halfway through they die. So I think it is not a very good advice. If you get symptoms, and you will inform or you will present yourself to the authorities, that is the health, the caretakers, and they will take the right decision for you. And they have the facilities, right? I would say not 100%, but some amount of facilities are there. Actually, you can be, treated and look after very well to their best, even though we have some restrictions in our setup.
Interesting, Doc. So what you're saying is, if you have found yourself COVID positive, you got to inform the authorities, you got to isolate yourself, and you have to go into proper medical care rather than staying at home. Not to wait until stage 2 or stage 3. That's what you're saying.
Absolutely. Stage 3 is almost like think it's you are in the hell. I don't think about even stage 3, because it's kind of a life and death situation. They are 50-50.
Interesting. So what happens when you isolate people? Sometimes I see that the people who are asymptomatic taken to quarantine, and then sometimes the people, all these people who are in quarantine, are they okay? Some are okay. I'm not talking about exceptions such as breaking the law and things like that. So is everyone in these quarantine centers, are they infected, or just on suspicion?
Yes, they are PCR positive people.
People who are in quarantine.
Yes, you don't take any person without PCR positive to the quarantine centers.
So in these quarantines, All right. In these quarantine centers, doc, there are proper medical care in case that they develop
No,
any
actually,
complications.
it is like that because our quarantine, this care system is divided into actually to 3 or 4 levels. The one thing is this. Now adding this home care system also, adding on this primary level, and then the quarantine centers, that actually these are dedicated to keep these infected PCR positive people away from the society. Right, they are just asymptomatic people. They just remain in the kind of a quarantine centers, and they are being provided 3 meals, and they are together, they are in a separate places. That's just to isolate from the rest of the society. And the next centers are actually the intermediate centers, where the people are having symptoms, right, not getting very bad. Maybe they need supportive care, that is the special attention from the health sector. That is the intermediate centers that we are having in many hospitals today. The next level is actually the high dependency units, or the intensive care units. So this is how these structures is being very well designed. So therefore each stage, right, even if you are a positive person who are asymptomatic, who may be in a quarantine center, maybe develop their symptoms maybe in the next week. So he will be transferred into the intermediate center, or where the HDO or ICU, whatever depending on their situation. So that is very well designed, and it is one of the, I think at the moment, so it's one of the best way to you can't find any other alternatives. This is one of the best way to look after, because the problem is now the capacity is exceeds. Then you have to think about the home quarantine and care at the home. So that's another level, and actually it takes a lot of strain, because the problem here is there's no one to monitor. You have to have your self-monitoring system. So there you might end up with sometimes, because if you don't have the real awareness about these symptoms and how to express them, then we don't know.
You're right, okay. I think the danger that the people don't realize is, in case that if the numbers increase, and if your medical facilities are fully stretched, and we go into, like, I know what happened in UK, that sometime in Europe, that there were people who were just they were left in their apartments and all by themselves, and nobody to take any medical care or whatever care. They were just left on their own. So I think that's what that medical societies and people like you trying to avoid, that country going into a complete mayhem and just getting out of hand kind of scenario. That's what it is, isn't that, doctor? I'm just
yes.
Right.
Yeah,
and then and that, as Asela says, but people who are coming from abroad are sent to quarantine centers. So, well, I guess, doc, your opinion on that?
So it's, I mean, those are things that you don't need to argue and all these things, because each country, each setup has its own policies to managing. I mean, if you go to some other country, right, if they decided this is how we are going to manage according to their system, according to their policies, according to their the capacities, so you have to obey with this the system. You will not go there and argue, but only people who are coming here, they have to prepare their mindset and come and adhere to the rules here. Because if you go to another country where alcohol is completely prohibited, and you are prepare your mind to go and stay there without alcohol, if you try to take it, you know the consequences.
As people say, doc, when you are in Rome, do as the Romans do. You can't go wrong.
Yeah, that is a simple way. I mean, you should not ask for other things, because I think every of these measures are doing for betterment of the people, not to harass or not to do anything. That is the baseline of these concepts. So you have to really respect. I think that is what the civilization is.
Well said, doc. Doc, I think we have been talking to you. I know that you are a busy man, that you have to get back. You are doing so many things. Keep the people like us educated. At the same time, there is operations going on 24 hours. In the meantime, I know how much work you do to educate everyone who's following you, doing your lectures. One last question, Doc. Out of everything, I know that you are very you got expertise in all sections. But why sports in particular? Why did you become a sports consultant? That's a brand new area in this country. Not many doctors, I believe.
Yeah,
And
I think
what made you?
yeah, that's
very
fun,
quickly.
because if I tell you like my story, because I'm a product of Vidyartha College, Kandy, and because I love sports. Like, that's my bread and butter in school, right? I played rugby, I played boxing, and also I was an athlete, right? Unfortunately, my sports career was disturbed by because of the boxing. I had my shoulder dislocation, and it became recurrent. And that was around 1987. Like, on those days, the this much of intervention, and also the recovery process, also the surgical interventions are not very advanced. Like, it's very primitive level of attention for sports all those days when it's come to the the care of surgical and recovery. So I suffered a lot, because then I cried myself in some occasions, because my colleagues are playing that I couldn't play. And that was the real thing in my mind. And so when I came to my advanced level, actually I couldn't even run, because the shoulder, they just came out. Even if I strain, then I have to relocate by myself, and it became habitual. And then anyway, when I came to my advanced level in the Sri Lankan setup, I thought, yes. And though I missed my sports, but there's another way, that is through education. I have to think of my life. And I did my A levels and get qualified to the medical faculty. And there onwards, the thing is, somewhere in the mind is, sports, right? so ultimately, when I was in the final year, even in the medical faculty, I just wanted to go to my library and finding out something related to sports. There is a one book that is called ABC Sports Medicine in the Faculty of Medicine, the medical library. That was there only in an isolated shelf. No one has been used for about the last 15 or 30 years. I just you went there and just read it. Everybody laughed at me on those days. Okay, what this man is doing, having a big final exam and all these things. So that's how it came. But it was in my blood. So I just really wanted, and I help rugby teams, like all the athletes. And then the Sri Lanka. Then after that, actually, when I became qualified as an MBBS, I was looking for all the opportunities to become a sports physician. But on those days, the sports medicine is not in the line. And in 2007, actually, first time we had the diploma in sports medicine. Actually, the one and only postgraduate, this qualification is offered by the Postgraduate Institute of Medicine, Colombo. PGIM qualified. So we became, actually, I was very fortunate to become in the first batch of diploma in sports medicine. And then I did a lot of my actually intervention, also with co-work with some other countries like Netherlands. I did my fellowship training under Professor Frank Bax. This Utrecht Sports Medicine Center is one of the best in the Europe, and everybody wanted to find some opportunity there to get an attachment. So I'm so lucky. I'm the first to go there from the Asian continent. And also did my diploma from USA, because that's all for my interest. But it took about some years. Some things are not happening the way that we want in Sri Lanka very rapidly. But at the end of the day, so MD, that is the highest qualification of sports medicine, offered to the doctors who are already qualified by diploma in sports medicine. So again, I'm it's a very competitive exam. Again, I'm so lucky, and also I'm fortunate to get into the first batch of fully qualified MD in sports medicine now. So we have 8 actually in our first batch who are actually in a very recent time. So once we complete our overseas training, we will be the first fully qualified sports medicine board certified consultant in sports medicine. So I'm very happy that we have come a long way, and even in other countries like Australia, maybe even in India now, we are just parallel to them. Actually, we also kind of introducing these things in very rapidly. So rapid in the sense we are actually in the slow process, but we are not for what my only intention is actually in future that Sri Lanka's sports medicine, the field or the service is very bright, because of this, whatever the development of sports medicine, especially I would like to mention the first people, the father of sports medicine in Sri Lanka is Dr. Major General Dr. Tureraja.
Yep.
He's the person actually who actually introduced and also started the sports medicine move in Sri Lanka way back in 1990s, and he was very active, and also the Sri Lankan colorman for 3 sports, right? And super personality, and he's one of my mentor, having his this Dr. Tureraja, and also with Professor Rohan Jayasekara, Dr. Lalit Vijayaratne, and there are key figures like on those days Dr. BJC Pereira. Even though they have their own fields, interest field, also established field, they were the people actually who were the giants to establish in sports medicine in Sri Lanka. So in a right way, like in a professional way, right? So, and after
I think
that,
your colleague is I've sent you a message, Dr. Sivali Javikrama, always.
Yeah,
He's another
I want
doctor.
to actually mention Sivali, and also now the current the Director General Lal Ekanaika also there. He's my batchmate when I was doing the diploma. But I'm very glad to say, you see the amount of development actually the Sivali is done, in the developing the doping, the aspect of Sri Lanka. It's very, very impressive. Like with all these difficulties, now we are in a better stage. I think in parallel, I think I have discussed with this Charith, in a very casual manner. Only sports medicine development is not enough to develop, or we can achieve the final results. We need this professional development in other specialties as well. So we know that physiotherapy, we don't have fully qualified sports physiotherapists in Sri Lanka, right? We need to have the fully qualified only in sports physiotherapy. There are a lot of physiotherapists who do a remarkable job here, and we must appreciate that, because that's basically purely because of their interest. But if we can get like Dulan, right? Like there are some few sports physiotherapists, especially musculoskeletal and sports specific physiotherapists, and they have even, I'm very happy that the fields are developing and the individuals are taking interest and go and even overseas, even though it's not available in Sri Lanka, and they qualified and they do it. And we need dietitians, like sports nutritionists, specialists, sports biomechanics, podiatrists, and also the special concern about the exercise physiologists. That is one area where we are lacking, like other than like strength and conditioning special trainees, we have a couple of very good qualified the people here who has a very good scientific background, which we can really deal with, and also understand the concept. And rather than going in a very conventional the method and what the ancestors done, no, that is out today, because we can't do what our ancestors did. So we have to, based on the evidence base and scientific base, and we have to update. You have to have the cutting edge knowledge to the practice and achieve the best. I would say in other countries there are about 8 or maybe 12 specialists around one the player to bring their level up. So where sometimes everything, even the poor coaches has finding to arrange everything, right? I know some coaches are, they have to arrange the bus for their athletes to for the transport, where you need to have a manager to do that. So many stories, and this, if you can develop parallelly, like sports medicine now today. So if you develop all the other these particular fields parallelly, so I think sports in Sri Lanka is very bright. and now we all are, I think, hunger in getting medals. Even if you take we want to have a Olympic medal, we want to win another World Cup, right? So likewise, like, it's a lot of hopes, and on top of that, I would say the raw potentials and also the talents which our the athletes are having, it's enormous. Only thing is, we have to add the science into it, the medicine into it, and get this maximum output to give the glory to the country. It is not easy. It is, you can't do it overnight, right? So it's a struggle of years. I mean, we are in a much better wicket today to actually actually to give our service. I'm very sad to say, sometimes even some of the trainees and the coaches and some areas, even some of the top the sports person who doesn't know that something sports medicine is really happening in Sri Lanka. So I think it's high time for them to open their the eyes and get this the service into their territory to uplift the all aspects of sports. Like, not only just people think that sports medicine doctor is just a person who just go traveling with around, or just running to the middle of the ground and just apply ice and do these basic thing. No, absolutely not. I mean, there are about injury management is just a 1/10 of his specialty, and there is a huge area, right? He will be covered, and he'll be expertised in many of areas which I mentioned.
I know, Doc. We'll be talking. We'll be talking in a lot to talk about in this field that people are not really aware of. The amount of work that what you guys do behind the screen, and thank you very much. I know that that I have done some work with you in the past at the national level. Is one of the reasons why I decided to have this chat with you. I have worked very closely with you in Kandy. You looked after us when we were there. Thank you very much. If I didn't thank you enough during that time, even few years down the line, really appreciate it, Doc, for looking after us. Final question: are we going to lose you in the future? Like many other top, what can I say? The professionals that who have left the country. Do you have any idea of leaving our shows in the future?
So we'll keep open the questions. We'll keep open. so many factors, like but my the intention is very clear, because we have to serve our own people, right? That's the baseline. So I in my mind at this moment, I don't have something like that, but we never know. Like, okay, because the life is the very different. Like, we never thought of that, something like tsunami or something like pandemic, the COVID the came like that. So I don't want to that's how the life is gone. Like, if you are in a fix the setup or a mind, I mean, it's very difficult to live. So whatever possible ways, right? So I think now it's up to actually all the sports stakeholders to take everything from us. So we are ready to offer it without keeping anything for us, because that's why, because we learn because of the requirement of the country, right? So I mean, of course we have our own interest, that's a different thing, but why these these qualifications are given in Sri Lanka, and and if you don't use them, it's just a waste of the initial investment. I think it's
all right, Doc. On that, yeah, I understand. I got to let you go. I know your precious time. I've taken too much time. My apologies. And if I ask questions that which are not medically relevant, and with my limited knowledge of the of your subject,
Charith, one more thing. Actually, I think with all these questions coming out everywhere, and I must thank actually Yose. Actually, she's my one of the the mentors in overseas. Actually, she's the lady who actually she's also joined here. I just now saw her.
Yeah.
Jose from Netherlands. Actually, she is one of the senior physiotherapists who actually linked me to Professor Frank Bax for my fellowship training in Netherlands.
Okay.
I have, enough of actually regards and also so thankfulness from my bottom of my heart, and thank you so much. I'm so impressed to see you, Jose, and so many other friends, and it's a very nice evening. I think one excuse from my audience, there were certain areas we couldn't cover today, and because of so many the questions and the interest, and also because I wanted really to adhere to this particular subject and also to educate you. But in future, like if my time is arranged, if Charith is okay, right, we can do some couple of sessions, to address some specific sports areas. It's a pleasure. I'm always willing to share my knowledge. That's my duty at the end of the day.
Thank you, Doc. Appreciate it very much for your time, your valuable time. I wish you all the very best in your future endeavors. Hopefully I shall see you on the other side and talk to you offline. So as we discussed, probably I'll drive up to Kandy to show you my back. I've been suffering with and anyone else and anybody else wants to get in touch with Doc, I'm happy to help. I could be the medium, or you could write to Dr. He's on Facebook. If it's not a hassle to you, Doc, I'm sure lots of people have a lot of questions for you. You can write to Dr. Asela Ratnayake. And I'm sure that Doctor will be obliged to respond to you. And thank you very much for all those people who have been online all this while. And hopefully until next time, take care of yourself, stay safe, as Doctor said. That's the main thing. And take care of yourself and take care of your loved ones. And we'll see you again on another show. Doctor, thank you very much.
Thank you so much. Good night.
Bless you. Stay blessed. Bye-bye.
Bye.